Geraldine Mitchell.
What kind of work do you do?
I'm a schedule maintenance coordinator.
Are those some of the jobs they may outsource? They get away with?
You never know. You never know.
Why is Kaiser trying to attack your benefits and wages?
Well, it's greed. It's greed. We're the people that do the work. We're the people that deserve the benefits. And it's unfortunate that we make so much money for Kaiser and that they don't consider our wages. They don't consider our patients. We're the people who care for the patients. We're the people who do the work. They're sitting around collecting a check off our blood, sweat, and tears, and it's not fair because the patients are suffering just as well as the members.
Are you outraged about the salary of these executives? CEO?
Absolutely.
$16 million?
Absolutely. What does he do for that amount of money?
Cut your wages?
Right. Outsource jobs?
What would it mean to outsource the jobs? They'd be doing the same work at less?
These people lose jobs every day. It doesn't make sense. I mean, if you want to strive to do better, you have to make sure that your workers are taken care of. When we're taken care of, we can take care of our members, and it makes everybody happy,
Now you have a lot of unhappy workers with what?
Yes, and we have a lot of unhappy members because the members care for the workers also. The same as we care for the members, they care for us as well.
You think that there should be private control of healthcare? Private control of healthcare, these executives running the healthcare system?
I don't agree with all that. I mean, they're overpaid and they don't do nothing. We're the ones who do the work. We're the ones who care for the patients. The patients care for us. So, I mean, why would you want to throw us under the bus? California has the highest cost of living anywhere. So, Kaiser says they help the homeless. But if you look over here in their own backyard, how are they helping the homeless? By giving them tents? That's ridiculous.
So they give them tents to help them?
Yes, to promote homelessness. It's right there in their own backyard.
You think they're duplicitous or not honest about their real position?
Oh, most definitely. You got to follow the whole situation. They don't want to come to the table. They don't want to present documents. Why? What do you have to hide?
Brandy Henderson.
What kind of work do you do?
I work in optical sales.
How are patients suffering?
Well, for the patients, they're suffering due to lack of staff. We have an ophthalmology department, for instance, that the workers are leaving because they're short-staffed, they're finding other positions everywhere, so the patients are suffering and appointments are backed up. You have some doctors that got 22 patients to 40 patients a day, and MA workers are paying for it because they're doing 4 other people's jobs.
So that must be pretty stressful.
It's stressful on all of them. They're finding other jobs in other places because Kaiser Vallejo is not doing what they need to do to staff.
My name is Jeanette Wiseman Campbell, and the issue for me is they're trying to outsource. They don't want to give us a raise, and rent is high here in Oakland. So I'm here to support my union and to support my coworkers.
And what kind of work do you do?
I'm an EVS housekeeper.
And they want to outsource that?
Yes, they do. And they want $20 co-payment. That's ridiculous.
And you work for the hospital.
I work for the hospital, and it already costs us $50 to go to ER. And that's outrageous.
My name is Keith Shanklin. I'm part of ILW Local 34. I am the president. And I'm here at this rally to support SEIU and Kaiser workers who are struggling to keep their union jobs. And it's time to stop all the union busting and all the privatization and try to introduce less money, poor services. How can you replace, how can you have better services with people you're paying less money to? That doesn't work.
Okay, thank you. And the port, they're trying to privatize the port. Ron Bonta and Nancy Skinner are here saying they support the Kaiser workers, but apparently that doesn't come to the maritime.
No, it doesn't. The same 2 senators who wrote these assembly bills against the port to change Howard Terminal into a ballpark are the same 2 senators here trying to support the rallying of the SEIU, because these are the guys who put them in office. So they understand that the people who put you in office, you got to protect those. But the little guy, you don't care about. When you ride down West Oakland, I want you to take a real good look. Look at West Oakland. Look at the demographic of West Oakland. It's poor black families living in shanty huts, tents, tarps, under the freeway, disenfranchised, nobody to speak for them. But when somebody raises up a voice and support them, then they have a voice. But until somebody does that, they will not have a voice and they will not be able to vote. The city council has not taken one step out of their sweet, pristine, air-conditioned office to go down into the streets to find out what the people want. Well, until they do that, they'll never be connected. They are not connected to the people. Your thing right now is to get connected to the people, and these are the people who put you in office, and these are the people that you have to take care of. Because when they take care of you, you need to take care of them. They put you there, so now it's your time to do your job.
I'm Jerry.
And are you a member of the union?
Yes, I am. I'm a social worker at Kaiser here in Oakland.
And you're here today, Labor Day 2019. There are going to be thousands of workers out here. What are the issues that concern you as a worker at Kaiser?
First of all, tremendous waste of healthcare dollars spent on ads. I imagine hundreds of millions, if not approaching billions. Why do healthcare dollars need to be spent for advertising agency, for branding, for attempting? I understand that $250 million are going to naming of an area outside the apparently Google outbid Kaiser.
The Warrior Stadium?
Warrior something, yeah, in the community. And I think that all those healthcare dollars should be for our patients, to reduce the load on doctors, to provide better care. Kaiser's has improved on efficiency, but not on quality of care, because quality of care takes time. You can't rush these appointments always in a 10-minute slot. We are an organization that's rolling in dough. Tons of money have been made. If you look at the books, I think the intake of money this year so far has been equal to the whole year last year, for an example. So what we're looking at is a corporation that is now more dedicated to making money as a priority than providing the kind of quality health care. So they're looking at pension eliminations. I think our younger pharmacists are not even offered a pension. And this is a...
How could that be? I mean, I thought that you were guaranteed a pension in Kaiser if you're Kaiser.
You're not. I mean, they're not union. We have both union and non-union employees. But the traditional so-called more friendly, at least cooperative labor spirit, Kaiser's has a history of working with unions, and so-called labor partnership, at least with some of the unions, is now being replaced by a much meaner and leaner organization that is not putting our workers and our patients first.
You think that there should be privately run healthcare systems in this country? I mean, it seems like all the money spent on advertising, charter schools are spending a lot of money on advertising. I mean, it's not going to teachers, it's not going to healthcare workers.
I prefer that every dollar of healthcare go into, as much as possible, besides like Medicare for all, go into a small amount of administration, but the vast majority of that money go providing healthcare services. So hence, any system that can take the money out of healthcare. Healthcare should not be a commodity, should not be traded on the stock market. Kaiser has a two parts of Kaiser, a nonprofit, and the doctors are stakeholders with closed books. I don't think this is the way to run healthcare in the United States.
My name is Ken Ho. My wife had a brain surgery January 2018 at Kaiser Redwood City. The next day, she had a seizure that lasted 45 minutes because they could not find a doctor on a Wednesday afternoon to authorize seizure medication. At 1:35 in the afternoon on Wednesday. Luckily, 4 nurses came and stayed with us until a doctor came 15 minutes later. And that doctor didn't know what to do, called her neurosurgeon, who hung up on her, laughed and hung up on her, thought it was a joke that she was having a seizure. Since then, she's been out of hospital. The last 20 months, she's been in a hospital for actually since January 2018, she's been in the hospital for 20 months. She's still in the hospital, and she's been vomiting for 6 months. They can't figure out what's wrong with her. And the doctors, even some doctors on the care team, encouraged me to demand out-of-network second opinion, which Kaiser had agreed to and has since denied. And they want to send her to a facility to die or just go home to die.
What does that say about Kaiser? What are they about?
Because they are all about money. They don't care about their patients or their employees. And all this time that my wife has been at the hospital, I experienced the short-handed staff that come to help and care for my wife. CEO, I reached out to the CEO, Mr. Bernard Tyson, a month ago and asked him to help because they're not helping my wife. They agreed to second opinion, then turned around and said, no tests, no further tests are needed. And Mr. Tyson said he would have somebody work with me to help my wife. And instead, last week, the CEO of the Kaiser Hospital in San Francisco, Mr. Ron Groper, gave me a letter saying that as of the 29th of August, I am responsible for over $6,000 a day for my wife's care while she's in the hospital. Now, they discharged her before, and I filed a complaint with the Department of Managed Health. They overturned their discharge, and since last week, I filed another complaint. Another complaint is in the works to overturn Kaiser's discharge. All they care about is sending her home. Here's a pictures of her condition. This is at Kaiser Redwood City ICU.
You have the ability to do better. The question is, do you want
This is
to do better?
2 months before this is Thanksgiving 2017. 2 months before the brain surgery that is almost taking her life with a 45-minute seizure the next day. Now this is April of this year, when she was doing much better at Kentfield Hospital that Kaiser was paying for. It's a rehab hospital in San Francisco. But 2 weeks after this photo, on May 9th, Kaiser said they want to take my wife back to better manage her care. The bottom line is it was costing Kaiser too much money to pay for the care. And since then, my wife cannot even stand up. She's lost 60 pounds of her body weight. She can't even bear weight, and they said she's dying. And
This is criminal.
it is. And she was sitting independently on the edge of the bed in April. And all they want to do is just send her home to die. They don't care. This is criminal. And the state has done investigations at my request of Kaiser Hospital State Department of Health, and they sustained one complaint. I have a letter I received last week, and they're working on other complaints of Kaiser. And this is crazy. They could not find a doctor on a Wednesday afternoon at 1:35 after she's had a seizure. And then when the doctor came 15-20 minutes later, called a neurosurgeon who hung up on her, left and hung up on her. I know this because one of the nurses afterwards came and told me, after she went into ICU, came and told me, Mr. Ho, the only reason it took so long is because, well, another reason is because they couldn't find the doctors, but after they found the doctors, because the doctor called the neurosurgeon and he left and hung up on her. He never came to help my wife after the seizure, but after the seizure, the next day he came and said, my surgery of brain surgery of your wife was fine. It's a seizure that's done it to her, which is true because she's been ill ever since.
Okay.
Linda.
And you're here with your instrument.
Yeah.
And why are you, as a musician, supporting this?
Musicians have always been undervalued. We totally get it with the Kaiser employees. Totally get it.
So you're with the Kaiser workers,
No, well, in spirit, but I'm not a Kaiser employee.
but you support their struggle.
Well, yeah, I'm here with the band Musicians Action Group. We're here to play.
I'm John Holmes. I'm a member of the executive committee of Peralta Federation of Teachers. Basically, what I and some other of our union members came here for is to support this rally because this is a very important event. We understand that the Kaiser workers are thinking about going on strike, and we very much want to support them. I'm from the Peralta Federation of Teachers. I teach at Merit, and whereas the teachers are in PFT number 1603, the white-collar staff are all in the SEIU. So our unions need to stand together. We're having issues that the Peralta system is very much under attack, and we need to take that very seriously. And so we need to stand up for ourselves, and we need to stand up for our union brothers of the SEIU at Kaiser, and of course, a lot of us have Kaiser Health, and we know all about the issues being talked about. It's not just the question of the way they mistreat the workers, it's also the matter of the way they mistreat the patients.
The tact and the behavior and the presumption to embrace what to all of those frontline caregivers is so different from what we've come to expect. This idea that Kaiser is just one among many corporate providers of health care failing patients. If that is not abandoned, if that is not changed, if that is not addressed, we are also going to have the largest strike in the United States since 1997 when the Teamsters went out on strike against UPS. And those of us in the labor community, and those of us, by the way, a shout out that the 83,000 frontline caregivers who are struggling today to get Kaiser off of this new mission around corporate health care. Kaiser Permanente, we are not going to lose our sense of outrage. We are not going to get diverted or confused because of all of the noise out there. You can do better. You have the ability to do better. The question is, do you want to do better?
That's right.
This is not about can we, this is not about should we, this is not about any of that. It's about do you have the will to live up to the historical legacy that you have inherited. The governor of Texas once said that a presidential candidate who came from a very affluent background was born on third base and he thought he hit a triple. And I think about Kaiser the same way, and the people who are leading that company who are stewards of what Henry Kaiser founded and created. You were born on third base and you thought you hit a triple, Bernard Tyson. You didn't hit a triple. You got there because of hundreds of thousands of people doing right by you, doing right by the rest of the executives, doing right by the medical group. You didn't build this thing, you inherited this thing. And you are a custodian of this thing. And we are not going to lose our sense of outrage. We are not going to lose our sense of morality. We are going to be in this thing until we do right, until you do right, until you do right by everybody up and down the state of California. The final point I want to make, and the biggest folks to shout out today are the 75 frontline care workers who in a few minutes are going to participate in a time-honored tradition in this country known as civil disobedience.
My name is Sean.
Why don't you talk about what you think is going on here with the Kaiser workers? They say they want to outsource their jobs and attack them.
Yeah, standard operating procedure for capitalist corporations. So nothing new here. Just So same old, but yeah.
So it's more profits for the owners of Kaiser.
Yeah, I mean, like what they said about Henry Kaiser, you know, he was an industrialist, shipbuilder yard, and, you know, workers were dying. He was anti-union and a union buster, so his totally would be aligned with the corporate model that Kaiser subscribes to today. So,
And what is the solution?
the solution, worker control of the industry, and expropriate the healthcare system, not just give it back to Kaiser and hope for better labor management cooperation, but actually workers dictate the industry.
So instead of the billionaires getting more money, the money going to healthcare.
Well, you know, it's not about, you know, it's not just about the money. It's about who controls, you know, the industry itself. You know, and when the workers control the industry, then, you know, it won't be a money issue because it won't, you know, that won't exist. It'll.
How long have you been an electrician?
15 years.
Shanika.
How is Kaiser trying to threaten your job?
They're trying to outsource jobs, so we're going to fight.
And that would mean workers doing the work at less pay?
I'm assuming so, yeah.
Outsourcing. What's driving them to do this outsourcing?
Probably to save more money.
More profits?
Yeah.
They say they're not for profits.
Oh, well, we'll see.
Are you ready to go on strike if you have to?
Yeah.
Oh, thank you.
You're welcome.
Why are you here today? What's your name?
Waiting for my job, Nicole.
Are you concerned that Kaiser is going to affect your job?
Yes.
How so?
If they lay us off or strike us or take away our jobs, any of those, it will hurt our families.
Is there a struggle to live right now as it is in the Bay Area?
Oh, yes. This is crazy right now. I don't understand all of this. I don't understand all the money that Kaiser make. I don't understand why they won't help us out.
They're building a new building. They're putting money for warriors.
Yeah, they putting their money into a lot of things except the workers today.
What do you think about these CEOs making $16 million, 100 making more than $1 million each?
I wish they would share just a little bit with us, just a little bit, and stop asking for raises and give us some raises since we are really there helping the patients out.
So you feel that they would actually cut wages of workers if they're successful in doing what they want?
Yes, I really do believe so.
Now they're also trying to outsource the bus drivers and other workers at Kaiser?
The gardeners, the EVS workers, the material management workers, the dietaries, anybody who's lower labors, they want to outsource us.
And a lot of them Latino, African American. Do you think there's a racial component to it?
Hispanics, well, that's the majority of who's working for the company. Is a lot of us Hispanics and blacks and minorities.
And they want to cut your pay.
Yeah, they want to cut the pay for the new employees that want to come in here.
Like 50% less?
Oh, yeah.
Would you be working with people making two-tier, 50% less, doing the same work?
No, that's not fair. I don't think that would be fair for anybody who's trying to, like my son, he's trying to get in here. I wouldn't want him to start off that low because it's hard. The rent is high out here. He couldn't even afford to live out here on that type of pay.
A lot of young people feel they have no future anymore.
Correct, and that's the truth. Yes, if jobs like this is like more for themselves and not for the people, then what opportunities do we have out here?
How long have you worked for Kaiser?
8 years. Yes.
Is it getting worse?
It has gotten worse, yes.
How has it affected you personally, getting worse?
It's more stressful. They put more pressure on us doing more jobs. It took me, out of 8 years, 2 years to get really benefited into Kaiser because they really didn't want to benefit nobody.
This is about Kaiser workers speaking truth to power. Kaiser has been a trusted healthcare partner of the ILWU since 1950. We were one of the first unions and the largest to endorse Kaiser Permanente Foundation healthcare. What's happening here today is that Kaiser workers are saying that this is not the same Kaiser of our fathers and grandfathers. Even though it is a nonprofit organization, it has billions of dollars in reserves and it pays millions of dollars to its CEO. They want to outsource the pharmacy. They want to also hire workers at 50% less salary. They want to get rid of the drivers, the gardeners. This is going to impact healthcare. Not only that, it's also going to impact workers being able to live in the city of Oakland and make a living wage.
How is this connected to the privatization of the port by the ACE owner, John Fisher?
That is a very good question, and let me answer it in this way. Anytime that corporate greed is the motive and the workers who are responsible for making those profits are ignored and exploited. What we're seeing now with respect to the Oakland A's ownership attempting to move to the third busiest port on the West Coast at Howard Terminal is a question of privatization and corporate greed. It is also going to impact one of the most important blue-collar jobs in the United States of America. That's dock worker jobs. People don't have to have a college education to be able to make $100,000. And I don't now mind saying it at all, because today, when a worker makes $100,000, the ruling class wants to act as if there's something criminal about that. When today it costs $3,000 for one of these new apartments, one-bedroom apartments in the city of Oakland under construction, 600 square feet, they want $3,000 a month. How can you pay for that making $15 or $20 an hour? It's impossible.
I understand Kaiser is providing tents for people over here across the way. Judith?
You know, I just wanted to add that I'm a Kaiser child because my mother in 1954, working for the Oakland Naval Supply Center, then was one of the first families to enroll in Kaiser Permanente. So we were all brought up through Kaiser, and my father, in fact, died through Kaiser. But I saw the change in healthcare, quality care, once I became an adult. Corporate greed took over, and the people have suffered since then. You know, so I don't care if they're providing tents. Tents is not enough. Tents. That's a Band-Aid on this problem of taking the money from workers. You know, Oakland is a working class city. They're trying to turn it into a middle class tourist destination. You know, finally, you know, they broke through the clouds of ghettoization and portraying Oakland as a terrible place. But now that everybody knows Oakland's not a terrible place and it's a beautiful place, they want to take advantage.
They want to kick people out.
Yeah, they want to kick us, people of color. They are kicking us out. They are kicking us out.
Gentrification.
Yes. Please,
ethnic cleansing.
Please go online.
Right.
My poem is called "Manhattan My Ass." You're in Oakland.
and 50 years ago, you were on strike at San Francisco State. You were in clearance. What's the relevance of that strike today? 50 years later, it seems like it's getting worse for people.
The one important impact of that strike is that we changed the nature of higher education in the nation. Okay, we changed the curriculum, and we changed the color and the complexion of the faculty. Okay, so that made it possible then for many young people of color and young people of different ethnicities to go to college and then finally begin to learn not only, quote, white history, not only, you know, about dead white men.
George Washington, good job.
Which is important for them to learn about, and also learn about many other persons of color, history of whom was buried. It was there, but it was buried. We had to learn that. See, once people are informed, they can act. I've been telling Clarence just a few minutes ago, you know, that I've been studying the Russian Revolution of 1917, but that had been it was swift and fast, but that had been in the making for many decades. You know, the Tsar had just run over people, you know, in 1905, 1907. No, this is building. You know, I've written a book called Virgin Soul about my time in the Black Panther Party and so forth. When I go around, people are always asking, oh, you know, people aren't, you know, doing anything anymore. I say, yes, they are. It's building. A pocket here, a pocket there, an Occupy here, an Arab Spring there. It's building. And once people have consciousness, it doesn't go away.
Working people have the power if they use that power.
Yes, and we unite.
In the cause for justice, and you're out here in the cause of justice. I've come out here as a friend, as someone who's been very much involved in the issues around labor my entire life as itself. I also come out here as a citizen as well, a citizen who is in support and fighting for the candidacy of Bernie Sanders for the next president of the United States. I come out here with that. That's the jacket I wear. I know that the process, and I understand the process has been a process, is a long process. I encourage both management and workers get together and walk away with a respected contract that serves both of us. That's what we're here for. We're here for that. We know that. And I support you in your efforts to have a collective bargaining agreement that works for the half of workers who do the work, who provide the services for patients and for those clients of Kaiser. I'm here in support of you, and that you continue that fight, and the struggle continues.
Patient care! Patient care! Patient care!